Okay, hello and welcome to the webinar. My name is Josh McDaniel. I work with the Wildland Fire Lessons Learned Center, and I think you're going to find the presentations very interesting that we have set up today, and also very useful. We're going to be covering the most important topic in wildland fire, and that's firefighter health and safety. And I'll let the experts we've assembled to explain the objectives of this in a little more detail. But overall, our objective in putting the webinar together was to increase awareness of heat-related injuries among wildland firefighters, and then also to share some prevention tools as well. So before I introduce the speakers, I just want to make a few announcements. This webinar is part of an ongoing webinar series that's sponsored by 3 organizations: the Wildland Fire Lessons Learned Center, the International Association of Wildland Fire, and the Joint Fire Science Program. I've put up some links on the site here, and I encourage you to check out the websites and look at the growing set of resources all 3 of these organizations are putting out in relation to wildland fire. Okay. Next, I wanted to talk about the upcoming webinars in the webinar series, and we have a bunch. Starting next Tuesday, Terry Jane of the Rocky Mountain Research Station is going to give a presentation based on a synthesis she did with a team of researchers on fuel management in ponderosa pine dry mixed conifer forests. And then after that, Nicole Vaillant is going to give two webinars about a month apart on some fuel treatment planning tools that she's been working on. And the first one's going to be on ARC fuels, and the second one's going to be on landscape treatment designer. That's a lot of the feedback we've gotten from the webinars. A lot of people are interested in tools for fuels management, and so that's what we tried to put together. In June, there's going to be 2 webinars that go together on the Monitoring Trends in Burn Severity project. And the MTBS project is a multi-year interagency project designed to map the location, extent, and severity of large fires in the U.S. from 1984 to present. Josh Picot and Jennifer Lecker are going to give an overview of MTBS on June 19th, and then Eric Adula is going to present how Grand Canyon National Park's been working with the project. Okay, so you can register for all of those webinars on the Advances in Fire Practice webpage, and I've put the link down there at the bottom. It's a little clunky there to read out, so if you just Google Advances in Fire Practice, you can get there, or you can navigate there through the Wildland Fire Lessons Learned Center website. Okay. So now on today's webinar, and I'll introduce the speaker in just a second, the first speaker in just a second. But first I want to sort of let you know how things work in terms of questions and those sorts of issues. In your control panel there, depending on what type of computer you have, it either says questions or chat, and that's where you can type in questions. And we encourage you to type the questions in, at the beginning of the first presentation, all the way through the last. But we won't answer the questions until we get to the end. Then we'll have a question and answer session, and we'll try to get through as many of the questions as we can. Okay, and at this point, we've heard that there are a lot of groups out there watching the webinar. So, one registration, but multiple people in a conference room or in some sort of meeting room watching and listening to the webinar. If you could, go ahead and type that into your questions box and let us know that there are, how many people are in your group, so we can get an accurate count of how many people we're viewing today. All right, so also one last note, the webinar is going to be recorded, and we will, it's usually available about an hour and a half after the webinar, as soon as we can get it uploaded. So we make a recording of the webinar and then upload it to the Advances in Fire Practice page, and I'll put that link up towards the end as well. And you can pass that link on to anyone that you think might be interested in this webinar as well. And we archive that on the Frames website, so it'll be there forever. So this, if you know anybody that you think might be interested in this, please pass it on. Okay, so that should take care of the housekeeping. I'll go ahead and introduce the first speaker now and start passing the screen over to him. Okay, so Joe Dmitrievich is an exercise physiologist for the Forest Service, and he works at the Missoula Technology and Development Center. His work revolves around wildland firefighter health and safety, with topics including nutrition, hydration, fitness, long-term health, PPE, and heat stress. Joe received his PhD from the University of Montana, and he's also an operational wildland firefighter, and he happens to be staged for IA in Globe, Arizona today with the Bitterroot Hotshots. All right, so Joe, I'll hand it over to you now.
Well, thank you everybody for attending. I want to welcome you as we kick into full gear this fire season, and we'll get this show on the road. So, heat illness, this came out of a journal of the thermal biology, and it kind of sums everything up. Human athletes exercising in the heat are considered to live on the edge of thermoregulatory catastrophe. And unfortunately, last summer in Texas, we saw this potential catastrophe become a reality. And so with that, there's nothing that we can do that's going to guarantee 100% protection from heat-related illness, because there's just so many different variabilities out there with people in every situation. However, hopefully the take-home messages that you guys will get today will help decrease that risk and make wildland firefighting hopefully a little bit safer for everybody. So, heat stress, what's happening? When you look at this figure, for us as humans, it all revolves back to the work. Exercise, whether it's running, riding a bike, hiking, sawing, digging line, 70% of the heat that our bodies experience comes from our own muscles. And so when we look at that, it all comes back to the work. How hard are you working? The environment is always a part of it, but it all comes back to the work. How hard are you going? And so from that, the harder we're working will raise our core body temperature, which then increases the skin blood flow to get rid of that heat. And the primary way we can get rid of heat is through sweating. However, the key is sweat has to evaporate off your skin. When you are really exercising in the heat and you feel that sweat rolling off or you're wiping it off, it's not evaporating, taking that heat with it. So sweat that rolls off your body or you wipe off, it's not doing you any good. So with that, when that skin blood flow increases, the blood going to the muscle and the core has to decrease. And that's where we start to see some of these multi-organ system dysfunctions. But also we see a decrease in brain blood flow. And Dr. Duncan, our next presenter, will go into a little bit more on why, we don't want warm blood going to our brain. So when we look at that, that's kind of the basis of what's happening here. So we look at the job of wildland firefighting. It's based on the classifications through OSHA and Department of Labor. It's considered very hard to extremely hard. Digging up, so we are going to be producing a lot of body heat from that. And then when we throw in our PPE versus exercising in shorts and a t-shirt, the ability to dissipate that heat through sweat decreases. Right now, through the Missoula Technology Development Center, along with a few others, we're looking at how much of an impact our PPE has on sweat dissipation. So this graph right here kind of shows the importance of pacing your work. This graph came from the University of Montana study that they conducted a few years ago. And if you look on the graph, if you look on this graph, and I'll pull up the pointer, this area right here is that typical range we'd see with wildland firefighters using an activity monitor. We just by luck happened to have one on an individual that went down with a heat-related illness. And the black line shows his work rate for that day and how it went up and down, but he was not pacing himself very well. And this individual drank plenty of water throughout the day, but still went down with a very high core temperature because of his pacing strategy was not where it needed to be to maintain thermoregulation. So that pacing on how hard we're working is very critical maintaining our core body temperature. Some work that has come out of San Dimas through some preliminary work on crew production rates, one thing we found is we did not see any decrease in production with our hottest days compared to our average days. There's no difference. So by maintaining that pacing on those hot days, that could be one of the key factors in mitigating some of these heat-related illnesses. And then the other key is, with that, is early detection. If you look at the two red lines on this graph, the one on the left shows the early intervention of an individual that had a high core body temperature and how quickly they were able to drop it down. Versus the red line on the right, the graph with the black diamonds instead of the open squares, shows that by delaying detection and intervention, how much longer it takes to get that core temperature back down to a safe level. So we need to be a little bit better on detection of why or once people have reached those levels. And Dr. Duncan will go into a little more specifics on what are some of the factors that cause some of these heat illnesses for better detection. So just kind of a little introduction is, how do we detect early? By looking at the conditions that predispose you to an increased risk of heat illness. So as I've said, working harder than normal is a key factor in wildland firefighting. That body heat we produce is probably our own worst enemy. The environment where we're working, the temperatures, the humidities, all that play into a factor. And then the individual factors between individuals. There's some studies that show athletes can work at very high levels of core temperature without any of the classic signs and symptoms of a heat illness, where their core temp has been elevated above what we consider critical levels, and they have no problems at all. So that individual component is very important in doing that. And so when we look at some of these conditions that predispose you, but once we've already gotten there, the signs and symptoms of a heat illness. And in the IRPG, our handy little guide, on page 45, we have some of the signs and symptoms of different types of heat illnesses. Heat cramps, heat exhaustion, and heat stroke, kind of the classic three. So wildland firefighting can be the perfect storm for a heat illness due to all those predisposing factors that we have to work on our environment. And so with that, I'd like to turn it over to our second speaker, Dr. Duncan, where he'll give you a little more information on heat illness.
Okay, I'm here. Thank you, Joe. You hearing me okay? Thank you, everybody, for joining us for this very important topic. I'd like to dive right into a little bit of a more medical approach to heat illness, cover a little bit of the pathophysiology, and try and give everybody a perspective that can hopefully help them take away a way to understand heat illness and to prevent and even treat heat illness to an improved degree. So with that, I'm going to move into the PowerPoint here. A brief overview is heat illness and rhabdomyolysis are often mixed up. I get this frequently from firefighters, and I want to just talk about heat illness today, but I want to mention rhabdo. And the perspective I want to give on rhabdo is it is a distinct entity. Rhabdo is different than heat illness. It needs to be placed in a separate spot in your mind and understanding. And a good way to think about rhabdomyolysis is rhabdomyolysis represents skeletal muscle injury and is one of the organ systems that is damaged by heat stroke. So think of it as just a simple organ system being damaged by heat illness. But the other note to make is that rhabdomyolysis can occur without heat illness as well. So we can have skeletal muscle damage with or without heat illness. That's the majority of the perspective I want to give on rhabdo and move on to heat illness. So both are precipitated by increased exertion and heat stress. Both are worsened by dehydration, poor fitness, lack of acclimatization is a big one. Certain medications, drugs, and substances can precipitate heat illness to an increased degree. Poor nutrition is becoming more apparent. There is significant overlap between the two, and heat illness can precipitate rhabdo, but again, let's keep them separate. I'm going to talk about these items and move right into the perspective and the continuum of heat illness. So heat illness begins at the lower level typically with heat cramps. People start getting muscle cramps for some reason or another. It's usually associated with an increased degree of heat stress. As time goes on, we'll actually move towards heat exhaustion, which is the most common significant heat illness that we see on the fire line. And then if we don't recognize those symptoms and we continue to manufacture increased heat stress, we move into the heat stroke arena, which is critical and can be lethal, as we've unfortunately seen. You're noticing that I skipped heat syncope, and the reason I did that is heat syncope can really occur at any point along this continuum. It can occur early on when we're just getting a little bit of heat illness, or it can occur later after heat exhaustion. Heat syncope can actually be the first sign of heat stroke as well, so we need to sort of separate that. If someone passes out on the fire line, don't assume it's heat syncope. Assume first that it's heat stroke until proven otherwise. Heat syncope, of course, is just losing consciousness in a hot environment. So the definitions of these things include heat cramps, which we commonly see. It's simply cramping of muscles in a hot environment, often associated with profuse sweating. The etiology is thought to be hot environment and possible sodium depletion. That's controversial. We move into the more significant entity that we see on the fire line, i.e. heat exhaustion, commonly associated with heat cramps, sweating, nausea, vomiting. These are the classics. Headache, malaise, lightheaded sensation. When we start getting into these other areas, confusion equals heat stroke. Oliguria is just simply decreased urine output and is indicative of a dehydrated state. When we start getting these more significant symptoms, we really have to start thinking about heat stroke. And when we start getting any of these symptoms, period, we have to start thinking hard about cooling measures and taking steps to change the direction of our heat exposure. So heat syncope I've talked enough about. Don't assume somebody passing out on the fire line is a minor illness. Assume somebody passing out on the fire line may be the first step towards heat stroke. Initiate cooling measures, and we'll talk more about that in a second. Where this became really apparent is in our Department of Defense recruits in basic training. Typically in Texas, where there's this huge heat stress, they'd be standing for prolonged periods of time at attention, and they'd drop like flies. Way back when, it used to be humorous before we knew how significant it was to watch people drop, but since then we quit doing that, thank goodness. So here's the big one. Definition of heat stroke is a core body temperature of greater than 104 degrees Fahrenheit associated with some sort of altered mental status. So that altered mental status could be that you did just pass out. It could be some confusion. It could just be odd behavior compared to one's norm. So those two together equal the definition of heat stroke. Heat stroke, and I'm going to just jump ahead for 1 second, heat stroke is typically associated with disintegration or failure of several organ systems. And I just want to point out that the definition of heat stroke is this high temp associated with declination of one of those organ systems, i.e. your brain, and an altered mental status. Many other organ systems are declining in parallel with the brain. People often get GI or CNS effects with exercise. Early warning. Skin is usually hot and dry, but maybe warm and moist. Heat stroke can occur with profuse sweating. Don't think they have to be hot and dry, as was taught years ago. Nausea, vomiting, headache, rapid heart rate, low blood pressure, confusion's a big one, irritability. These are more significant, of course, delirium, seizure, or syncope. Complications of heat stroke include that end-stage organ damage or injury, including rhabdo, which is indicative of skeletal muscle injury. Shock, DIC is a problem with our blood system. Liver failure, kidney failure, cerebral edema is often what leads to death, and that's why heat stroke is such a significant illness. It needs to be thought of as a critical illness requiring critical intervention. Here, I think, is one of the most important slides I can share with you, and that is that heat balance is essentially a law of physics that we cannot defy. So what I want to point out to everybody is that in the environment we're interacting with, there's a certain degree of heat production that's going to occur and a certain degree of heat loss that's going to occur. We can't change those all that much. If we're going to decrease the accumulation of heat leading towards heat illness, we need to either decrease heat production or increase heat loss. And I want to point out the position of the fulcrum can be changed, and where this fulcrum lies in the continuum can be changed by one's degree of fitness, one's degree of hydration, acclimatization, which is how used to that hot environment one has become. That typically takes on the order of 1 to 3 weeks. One's nutrition, genetics, and then drugs or medications one may be on are also going to change the position of the fulcrum. So we want to lean towards increasing our ability to optimize heat loss, and that will decrease our chances of significant heat illness. So what about this heat production side? Heat production for the individual, particularly the firefighter, is predominantly incurred by our metabolism. We're working extremely hard. We're producing an incredible amount of heat. We also are working in a hot environment, and we're conducting a significant amount of heat into our body. Radiant heat comes in from the sun if it's a bright day. We have all these things to contribute to the heat load, i.e. the amount of heat we're taking in, and the only tool we have to get rid of that heat is evaporation. So the overall balance is we're producing and incorporating a lot of heat. We only have this one tool to get rid of heat. We can't defy the physics. We need to change one or the other if we're going to avoid heat illness. So what actually happens when we move into this heat stroke arena? Well, not to go into too much detail, but proteins that make up our cell walls and our skeletal muscle, etc., actually start to break down, and we can say that that's the first point at which proteins begin to cook. They become dysfunctional. That leads, unfortunately, to cellular dysfunction, and that in turn leads to organ dysfunction and death. The first thing we often see is the change in mental status. So this is an important slide, and Joe had this slide as well, so I think it's important to reiterate that the risk of heat illness increases with two things. One, we always think in terms of heat illness increasing with increased temp, but heat illness also increases, or the risk of heat illness also increases with the degree of relative humidity. Now we know that, but we often don't understand why that's the case. The reason that's the case is very simple. As humidity increases, we lose our ability to sweat and optimize that evaporative cooling. We also, unfortunately, create this same scenario when we bundle up and we lose our ability to evaporate and lose heat via the only significant means we have, i.e. that evaporative heat loss. So bear in mind, this is an important table. Our risk of heat illness can be significant, even down at 80 degrees if we're approaching 90 to 100% humidity. For those of you who are familiar, I think most of you are, with the wet bulb test, the Army actually developed that wet bulb test to reflect the injury or the the possibility for heat illness because the wet bulb heat monitor combines both temperature and humidity to give an overall risk of heat illness. There are several drugs that contribute to our risk for heat illness. That includes, I like to lump them into the anti-anything category. The antihistamines, i.e. Benadryl, Claritin, can increase our risk of heat illness. They decrease our ability to sweat to some degree. Anticholinergics, a class that few firefighters will be utilizing. Antipsychotic medicines are going to be rarely seen. Antidepressants may be seen to a significant degree, and those can increase our risk. Sympathomimetics are any drug or pharmaceutical that increases or revs up our metabolism. So, of course, methamphetamine or cocaine are obvious, but things we might not think about are Sudafed and ephedrine. Caffeine also is a sympathomimetic that, if taken excessively, can increase our risk of heat stroke or illness. So why is firefighting the perfect storm for exertional heat illness? It's worse than the athletic exertional heat stroke patient because we've taken that exact same scenario, but we've bundled ourselves up. So we have largely taken away our ability to do our own cooling, i.e. that evaporative means we need to bring our heat down. So we have increased heat production through, impressive exertion, through increased ambient temperature, extreme environments. It's always in the summertime, significant exposure to fire and direct heat. We're distracted by performing important duties. Life-saving duties are going to distract us from paying attention to our risk of heat illness. We may have some degree of altered physiology. We can become dehydrated, etc., and not pay close attention. We also have decreased heat dissipation. Our clothing and our gear, as I mentioned, block our ability to maintain and optimize evaporative cooling. And again, notice dehydration is on both sides of this equation. If we're dehydrated on this side, we're going to increase the heat stress that we incur. If we're dehydrated on the dissipation side, we're not going to have ample fluid to optimize evaporation. So heat stroke treatment, what do? Well, we do what we do for most significant or critical problems. That is, we invoke the ABCs, of course, but what I really want to iterate to this group is that we need to think in terms of the antidote for heat illness, particularly the antidote for heat stroke, is early and aggressive cooling. So ice is tough to come by, but ice baths, cold water immersion, ice packs to the axilla, neck, and groin. Ice saline lavage is something we do in the ER. It's not so typically seen in the field, but evaporative cooling is a big one. If we can get people cool, if we can get water on them and begin fanning them, get them in the shade, all these things are going to begin the cooling measures that they've lost. Another point I haven't mentioned that's important to mention here is that by the time we've incurred heat stroke, our brain has become overheated and it's lost its ability to tell the body to cool. So normally the brain tells blood vessels to dilate, let's shunt blood to the skin so we can optimize that evaporative cooling. The heat stroke brain loses its ability to do that, so we have to take that exercise on for these individuals. Rapid cooling is associated with lower mortality. The goal is to reduce body temp to less than 39 degrees within that golden hour. If we can do that, we can greatly diminish long-term bad outcomes with heat stroke. Heat stroke prevention, I want to point out that risks are additive over 1 to 2 days. So if you were ill yesterday, if you drank a lot last night and you're dehydrated this morning, those risks perpetuate into today. So if you had gastroenteritis, nausea, vomiting, diarrhea yesterday, you may not be back to snuff today. You need to be sure you're well hydrated, you're back to your baseline. You should start your day well hydrated so that you can optimize both your body's ability to maintain good circulation and maintain good evaporative heat loss. Cooling measures when individuals get an opportunity, i.e. at breaks, at lunchtime, your temp's going to be rising. So if you can take every opportunity to drop that temp back down, that's going to be advantageous. Nutrition in frequent, smaller amounts through the day, maintain blood glucose. That decreases the risk of heat illness. Rest, rehabilitation are obvious. And I guess that's it. So I guess we'll hold questions to the end. Thank you very much.
Okay, thanks, Dr. Duncan. And I want to apologize. I was pushing buttons behind the screen. I didn't get a chance to introduce Dr. Duncan, so let me do that in a retroactive introduction. Sorry about that, Dr. Duncan. But Dr. Duncan is a board-certified board-certified emergency physician practicing in Northern California for the past 20 years. He did his residency training at UC Davis, where he developed an interest in heat stroke and invented a heat stroke cooling bed called the barbecue, the Bed Attached Rapid Cooling Unit. He's been involved in EMS for the last 10 years, and for 2 years has been the medical director for CAL FIRE and CalSTAR Air Ambulance. So thank you for that, Dr. Duncan. That was very, very interesting. I'm going to, and now just to make it more confusing, I'll introduce another David. And so David Allen is going to speak next, and David Allen is the District Fire Management Officer, at Sequoia Kings Canyon National Park. David's career with the National Park Service started in 1989 at Yellowstone on the park helicopter crew. He moved to Yosemite National Park as a prescribed fire specialist from 1990 to 1998, and next his career took him to the Indiana Dunes National Lakeshore as their fire management officer from 98 to 2000. From 2000 to 2012, he held the position of District FMO for Sequoia National Park, and last week he was promoted to the position of Park Fire Management Officer for Sequoia Kings National Parks. He's been on incident management teams for the last 6 years. He's been a member of the NorCal Team 2 and the California Fire Use Team as a Type 2 safety officer, and he's currently a safety officer Type 1 trainee on the California Team number 1. All right, so David, I will turn the screen over to you. There we go. It's up.
Good afternoon, everyone. Thanks for joining us today to talk about an important subject, and the subject is very timely. In my career, I've seen more heat illness at this time of the year, early in the fire season when we first start going operational and we haven't quite acclimatized to the heat, and maybe our fitness levels aren't at a level they should be. So the subject today is very timely as we start heading into planning level 2 and 3 and maybe 4 and 5 later in the fire season. So I'm talking today from the incident management team's safety officer perspective, and I've talked to several safety officers in the last couple weeks to get a collective knowledge of the best practices going on throughout the country, and specifically talked to folks that were in Texas last year and developing in real time some best practices. And I also wanted to remind the group that 95% of our responses or our shifts on wildland fires aren't, we always utilize ICS, but 95% of the time we're not in that Type 2 or Type 1 configuration. So if we don't have a wildland fire safety officer assigned to our incident, those duties we still need to ensure the job's getting done, and they default to the IC. And I'm going to limit my comments. There's a lot of overlap and responsibility on mitigating heat illness throughout the ICS organization. I'm going to mostly talk about strategic mitigations, and I'm going to leave it to Britt to talk more tactical, on-the-ground operator, firefighter, crew boss mitigations. But certainly the safety officer has a role in tactical mitigations. Everyone on the IMT has a role, from logistics to operations to safety to command. It's really system safety. So I'll talk big picture, and then I'll pass it in a couple minutes over to Britt Rosso, and he'll be talking some tactical mitigations. So I wanted to bring our attention to a really valuable tech tip from the Missoula Technology and Development program, and it's featured on the Wildland Fire's Lessons Learned website on their roller on their front page. There's a picture of a sun, and that will bring you to a publication called Heat Illness Basics for Wildland Fires, and some of the graphs and that we've been showing today are featured in that publication. So I encourage people to go and pull that. If you don't have that publication, pull it off the website today or sometime this week. It has a lot of really good background they make for heat illness for firefighters on there. A lot of the mitigations, or I would say some of the mitigations, we really need to be focused on before we get to the incident. Once we get to the incident, our decision space as ICs, crew bosses, division soups, our decision space, our ability to mitigate risk for heat illness shrinks. We need our firefighters to show up fit for duty, rested, and acclimatized, but that doesn't always, we're not always in the most optimal space. So we need to recognize that at the incident management team level and realize that we may not be dealing with the most optimal playing field, and our decision space has been shrinked. And the temperature, and specifically the heat index, is going to shrink our decision space. And I think it's quite telling that all three speakers so far have showed this graph, and it is in the publication I talked about, Heat Illness Basics for Wildland Fires. And the way I use this as a safety officer in a strategic sense, I look at the low, medium, and high as different trigger points, especially when I transition from one area to the next. So to remind us what we're looking at is there's temperature on one axis and relative humidity on the other axis. So if we have a relative humidity of 65 and a dry bulb of 92, my decision space and our decision space on an incident management team, it is shrunk as far as our ability to get work done on the line, and we need to recognize that up front. So at the crew level, we would use this graph differently. If you're using this graph at the crew boss level, you may set trigger points, and I believe Britt's going to talk about this, of when to rest your crew or how hard to push your crew. At the incident safety officer level, I use this for discussions with operations about setting the shift length, setting our overall strategy for the fire, and number of crews and types of crews to order, recognizing that if we're in the high level, we're going to really need to use local crews that are already acclimatized. You cannot take a crew that's not acclimated to heat and operate it in the upper right-hand side of that graph. It just won't work. There's a limit of what humans can perform under heat. If we're utilizing out-of-region crews, which is pretty typical in Region 3, maybe at this PL level today, northern crews haven't started streaming into Arizona and New Mexico, but when they start doing in the next week or two, we need to give them time to acclimate. And I really think we really notice it when we go to altitude and we're hiking. The thin air really forces us to work hard, but we need to be thinking the same way as it goes to heat. It's not as clear and present in our mind because altitude just makes us sit down and take a break because we lose our breath. When we need to look at it the same way as heat is, as Dr. Duncan pointed out, it can take 1 to 3 weeks to acclimatize. We need to adjust operational objectives when we hit some of those trigger points in those graphs, or we're operating in different areas, is just plan on getting less work done in a given shift of work. I think culturally, wildland firefighters for good reason. We've gotten away from working night shifts, especially in areas with heavy timber, mixed conifer belts, because of the danger from hazard trees, especially at night. Trees fall, we can't see them, and so I think we've utilized, gotten away from night shift for good reason to mitigate that snag risk. But I would say every fire is unique. If there isn't, if the danger or risk of heat illness or injury is high, and the risk and danger from snags is low, we may want to move towards a night shift or a shoulder shift where it starts very early in the morning and you're done work at 12 noon. Another way to look at that, if that's not possible due to the hazards of a night shift, is we simply can stage during the heat of the day and be ready to respond, but try to get the majority of our strenuous work done in the morning and in the evening, and during the heat of the day just stage ready to respond to slop overs or spot fires. Talking again from the strategic level, and prevention is culturally, Red Bull, these energy drinks are pretty pervasive across the fire service. These drinks are diuretic, as Dr. Duncan pointed out. Caffeine, they're loaded up on caffeine. They do not help. And I think culturally, from a strategic level, we need to get away from those from wildland fire. And sleeping is very important in order to get a rest and to mitigate the fatigue. And we've seen good use of these mobile sleeping units over the past couple years. So shifting to the next phase of what I wanted to talk about here is detection and response. So what we just talked about was prevention, but we can never drive the risk to zero for heat illness. So it's going to occur from time to time, and so we need to get early detection. So yeah, our firefighters need to be out there looking for it, our crew bosses and squad bosses. So do our division supervisors. They really need to monitor the crews, and we don't want to have the division supervisors. They really need to set the pace and tempo of the production out there and set the operational objectives where they should be based on what the heat is. Don't let the firefighters and the squad bosses set the tempo of what the work is to be done. And there's, as the two previous speakers talked about, page 45 of the IRPG is some good guidelines. Medical plans need to be bench tested specifically for heat illness response, and referring to page 49, the insert for the IRPGs is we need to ask questions, bench tested, for how would this medical plan is built today if someone got hurt and needed to be evacuated, how could we get them to a cooler environment? How long would it take to get them to a cooler environment? And the last thing I wanted to talk about is suggesting that line paramedics and line EMTs be able to carry forehead scanned thermometers in order to monitor firefighters for heat illness. You can get a really good take on core body temperature that way. Instead of just waiting for symptoms, outward symptoms to develop, we can actually monitor it directly and see what their core temperature is. And that's the end of my presentation.
All right, Dave, I appreciate that. That's very interesting also. We'll move on to the last presenter now, and that is Britt Rosso. Let me get switched over to Britt. All right, Britt is the center manager at the Wildland Fire Lessons Learned Center. He also is works with the National Park Service. Britt has over 28 years of fire experience. He started his career on the Eldora National Forest in 1984, working on a 10-person fire crew. In 1986, Britt moved to Sequoia Kings Canyon National Parks to become a crew member on the Arrowhead Interagency Hotshot Crew. And in 1996, he was appointed Arrowhead IHC Superintendent, and he filled that position for 10 years. In 2005, Britt was awarded the National Paul Gleason Lead by Example Award for mentoring and teamwork. In 2007, he became the Kings Canyon National Park Fire Management Officer. In 2010, Britt was selected as the new center manager for the Wildland Fire Lessons Learned Center located at NAFRI in Tucson, Arizona. All right, Brett, so you can take it over from there.
Thank you, Josh. Appreciate that. And I want to thank everybody for participating today. Just a little side note, I'm filling in for Mike Alexander, Pike Assistant Superintendent, who is going to put this presentation on for us today, but actually got called out for a fire in Colorado, so he's doing what he's supposed to be doing, so I'm going to fill in for him. And I'm going to be filling the role of the operator in the field. So that firefighter in the field, we've heard the science, the physiology, the technology, the response for the incident management team safety officer. So now I'll address just for a few minutes for that firefighter in the field, from the crew boss level to the firefighter, how could we take all this that we're learning and implement it and try and create a better work environment, safer work environment for our folks. So physical fitness, establishing that pre-season, not coming to work to get in shape, but coming to work in shape, stressing that with your folks, and maintaining that level of physical fitness throughout the fire season. Being able to acclimatize to that heat, that environment. Sometimes it's hard. I mean, if you're like I was, a hotshot station at 6,500 feet and 80 degrees is a hot day there, and you go down to Phoenix or Tucson or anywhere in the desert for that next operational shift, are you really ready for that environment? So be able to become used to that environment and maintain that, if at all possible. Hydration, we talked earlier about drinking water is not the only answer, but maintaining that level of hydration is extremely important. One of my old captains used to talk about the internal canteen, how you need to reinforce with the firefighters to maintain your internal canteen up to the top level and not let that level drop. The electrolytes and cold if possible. Nutrition, eating right, sack lunches, we get from fires. We need to be able to snack on those, but also supplement that with either energy or sports bars, and snacking throughout the fire shift, not just waiting until someone tells you, okay, it's lunchtime, but taking those small bites as we work through the day. PPE has been mentioned previously. We can't change the PPE that's issued to us, but thinking about being able to ventilate, possibly remove the helmet when appropriate, and using common sense. Obviously, we're not going to take our helmet off in a snag patch, but if we're in shoulder-high brush and we're taking a break in the shade and you need to vent some heat out, use common sense. Something else to emphasize, that self and buddy awareness, knowing yourself and knowing your troops. Know your own tendencies and symptoms and signals. Do I feel right? Do I feel normal? Or am I feeling a little bit off? Am I just not feeling right? Am I stumbling? Am I slurring my words? Is my partner not acting normal? And that's part of knowing your coworkers and keeping an eye on your firefighters, on your buddies. Maintaining spot checks with your troops. Don't wait for something to happen, but especially in these hot environments, or when you first engage in these hot environments, maybe taking the short tactical pauses and seeing how everyone's doing. Do a buddy check. If your supervisor, being able to float amongst your crew and seeing if folks are acting normal, ask them a few questions and see how they respond. A very short case example for you. In 1994, when I was on Arrowhead as a sawyer, we went from the park, nice cool environment, to the Tonto National Forest, where crews are fighting fire as we speak. And we're inserted on a fire, and the high that day was 116 degrees. We had 110 before noon that day on our sling psychrometers, so we couldn't measure the temperature after that point. It was not an active physical work shift, but just being in that environment and not being ready for that heat. Crew was spread out along the fire line. not doing much work again, but the overhead, the superintendent, the captains, the squad leaders were floating amongst the crew, checking on them, bringing them water, making sure everybody was doing okay. And at the end of the shift, when we hiked out, which was a pretty mild hike, a few miles back to the trucks, we had one firefighter go down that we had to extract. By the time we got to the trucks, the squad leader went down, was on all fours underneath the truck. The captain was down, and the superintendent was inside the soup truck with the air conditioning cranked with a EMT watching him. And I can remember looking at that superintendent on that hike out when we took a break, and he was pale, and he was there was salt on his face, crusted on his face. And he was not sweating, and that meant nothing to me other than it looked a little different. When I look back on it now and what I've learned about the heat-related injuries, he was probably approaching heat stroke, and we did nothing other than keep hiking and head back to the trucks because we're hotshots. And that's a cultural thing I think we're trying to change. I'll mention just briefly the IRPG page 45 again. Take a look at that preseason. When you go out on the hot shifts, maybe review it during your briefing with your troops prior to engaging on that shift, and then communicate that amongst each other. Dave Allen mentioned a little bit the alternative shifts. About 98% of the fires we go to are initial attack. They're not managed by incident management teams, type 2 or type 1. Something Mike Alexander talked about, and that he tried with his crew last year in hot environments was a bimodal shift. Dave Allen mentioned it. Do you start at 03 and maybe work till noon, and another crew comes out later in the day when things have cooled off and cover that part of the shift? So that would be one option. Night shifts. When I started, they were common. Not saying good or bad, but we don't do them much anymore. And I understand that in the timber, really steep terrain, lots of high hazards, but in brush and grass and a lot of other environments out there, why wouldn't we pull night shifts rather than a day shift out there when it is 105, 110 degrees? The fire line work rest as a supervisor, whether it be a crew boss, engine captain, module leader, we're responsible to set that work pace and tempo for our troops. It was interesting to hear Dr. Joe mention that the early research with San Dimas on the production rates with crews, they didn't change their production rate from a normal work environment to a very hot work environment. And I get that. I understand that as an ex-hotshot. You just have one pace. It's either we're working or we're not working. And I think we really need to step back and look at that and see if we can maybe change the way we do that and modify our pace and tempo based on that environmental condition. And being flexible is absolutely the key. Whether that's we're going to shade up during the heat of the day, we'll cut in the morning, we'll shade up, and in the afternoon we'll get back after it. Or maybe let's not pull a day shift, let's go get this thing at night. Being flexible, working with the IC, working with a team, your division, that safety officer. I think that's really the key message. And then recovery. Mike and I talked a little bit about, and what he tried was if someone's starting to feel some early symptoms and you're near the trucks, go put them in a truck and crank the AC, and they actually did that a few times. They tried, if they were just in patrol mode and it was a roadside fire, rather than have the troops out there walking along the fire all day, put them in the trucks, crank the AC, and then patrol by truck. And if you see a problem area, drive up to it, jump out and take care of the problem. So again, it's being flexible, and I think also thinking outside the box from our normal operations, the way we're normally used to doing business. And Dave talked about the cooled sleeping trailers. Overnight AC, it's critical if at all possible. A school, a hotel, the yurts in the fire camps that might have a swamp cooler, something to get them out of that hot environment to have some level of recovery before the next shift. Treatment, I'll just skip through this real quick because the doctors covered it well, but early recognition is going to equal early treatment. Catching it early, stages on the fire line, and treatment on the fire line. Do you need to get back to a vehicle, back to camp, back to the spike camp to be assessed or get them out of that environment? And then transport, there's many ways, of course, to transport, whether it's through your fire vehicle, an ambulance, life flight, whatever the level of severity of the injury is. And returning to work, that's something I think we don't put a lot of emphasis in, is when we do have the heat injury, we get them back to camp, The next shift comes up. You good? Yep, we're good. Let's go. Are they really good to go? And we put them right back into that environment. Maybe we need to think about what duties they're assigned. Maybe they're back in camp taking care of logistics for one shift to recover. And then last slide, is it an emergency? Every situation is different. Treat it as such. What I've learned is that an altered mental status equals cooling, early cooling, and medevac. If they're not acting right, if there's altered mental status, talking to the doctors, you need to give them early cooling and medevac them, because it is most likely early stages or signs of transitioning from heat exhaustion and heat stroke. Any loss of consciousness whatsoever, absolute early cooling and medevac. Initial treatment methods are not being effective. You probably need to reassess what you're doing, what your treatments are, and get additional assistance. Are the symptoms becoming more severe? Are they trending towards becoming more severe? You probably need to reassess what you're doing. And then last, as an old hotshot, I did that for 21 years, 10 years as superintendent. What would I do different if I was still running a crew today? What I will just share with you is that I've learned more about heat-related injuries in the last week preparing with this panel than I learned in 21 years as a hotshot. And that is not a good thing. So what I would ask you in the group today to do after this webinar is to go out, do your own research, go find some of these resources the other presenters have talked about, get online and do web searches, and there's an incredible amount of information out there. And thank you for participation in this webinar today.
All right, I believe Joe Dmitrievich is going to handle the question and answer session. Joe, are you there?
Yeah, I'm still here. So I guess I'd like to... Screen went blank on me. I guess I just want to kind of reiterate here the key points for mitigation, kind of what we talked about today. Work when you get the most production. You need to balance that reward to risk, as we do with everything. Pacing strategy is key. Most of the heat we experience is from our own body, so that pacing strategy is critical. Maintaining health. Illness can have a major impact on how our bodies manage heat stress. And then if you don't feel right, tell someone. That early detection is key. If we do get there for some reason, that early detection is critical for recovery. So with that, I'd like to open it up now to questions. If you go to your little menu there, and there should be a questions tab where you can write something in, and we will hopefully be able to answer everything for you. So they're starting to kind of come in right now. I'm not sure if everybody can read them, so we will read them out kind of as we go. The first couple I'm going to turn over to Dr. Duncan. These were from Larry Sutton, and the first one was, do anti-inflammatories like ibuprofen contribute to heat illness? What about the other NSAIDs?
Sure, I can take that on. So non-steroidal anti-inflammatories don't necessarily contribute to heat illness. They have been implicated with many other medications directly affecting rhabdomyolysis, but probably to a mild degree. A general rule with medications, either prescribed or otherwise, and substances in general, is we can just say, everything in moderation. Remember, we've got that balance between heat production and heat loss, and the meds, the fitness, the substances change the balance point on the teeter-totter that I showed earlier. And the goal is, anything we do on the negative side can change the balance towards worsening our accumulation of heat stress. So non-steroidals do not specifically increase our risk of heat illness.
The second question is coming from a few different individuals, and this I'm also going to give to Dr. Duncan, is What are the likely impacts of tobacco use, smoking or chewing, on heat illness?
Sure. Tobacco it has a mildly sympathomimetic effect, which means it does tend to rev up heart rate, it does tend to rev up respirations and muscular activity to a mild degree. Those that use tobacco regularly are probably not at significantly increased risk, but again, everything in moderation. So if you use those things regularly, you don't want to certainly overuse them, and you want to minimize use of them on a high exertion day because they will increase your risk of heat stress to a mild degree.
All right. This next one comes from Dr. Hales, and he talks about how there are some other guidelines developed by the military and the sports medicine community on hourly work rest cycles, and I just want to reiterate that to the Wildland firefighter community. The American College of Sports Medicine and the military have looked at heat stress for a very long time, and they have some great recommendations. Currently in the wildland firefighting environment, we use temp and RH primarily only with our felt weather kits. However, there's also the effect of the radiant heat that we don't account for, and that's one thing that is there better devices out there to identify heat stress. So those different kind of pieces of equipment are out there, and there are some great resources. I'll throw this one out to the whole group. This is from James Osborne. Is cranking the AC in vehicles and staying in hotels going to slow acclimatization to hot environments? Does anybody else want to take a stab at that one?
I can, Dr. Duncan. It's unlikely that that's going to affect acclimatization because acclimatization is a relatively slow process. Acclimatization does progress more rapidly, probably the higher the heat stress, but that's not been studied. So it's tough to say. Basically, acclimatization is going to be directly proportional to the degree of heat stress a given individual is exposed to over the course of a couple of weeks. So it's hard to say the direct effect that's going to have. The benefit that that's going to have may offset, i.e., if you give those muscles a chance to repair, cool down, you're going to minimize chance for rhabdo, you're going to minimize chance for heat illness, you'll be able to progress your fitness, etc. So that's a sort of multifactorial, somewhat complicated question.
Our next question I'm gonna toss over to some of our operational guys. This is from our brothers down under. In Australia, we do mostly truck-based crews. Can you suggest tools and strategies to manage heat issues? Britt or Dave, do you guys have any thoughts on that?
I think it mostly comes down to, modulating the amount of that heat balance slide Dr. Duncan has. Is you can't change reality. Reality always wins. So you have to ensure that your heat cooling is greater than your heat production. So there may be specific challenges to their trucks in Australia, which I'm not familiar with, but the basics is, the higher the heat is, they may have to increase the work-rest or decrease the work-rest ratio.
This is Joe. Yeah, I'd have to agree with that. I think when it comes down to it, it's just balancing that equation. Regardless if you're a hand crew, an engine crew, a rappel crew, it's that work rate in how much work you're doing and how much heat you're able to get off based on all those other factors. This question is from Tammy. Are these conditions, are there different conditions and measures for hypothermia? Where does this condition fit into heat stress? Hypothermia, Tammy, is just kind of an overall general term for elevated core body temperature. So hypothermia is kind of that overall umbrella term where heat, heat cramps, heat exhaustion, heat stroke all kind of fit into that. It's just that big umbrella term for those different heat-related issues. I guess this one is for Dr. Duncan. What is a typical maybe forehead temperature that you might see in someone who would be suffering from a heat injury?
Well, in general terms, remember, anything in medicine starts at A and ends at Z. There's a slippery slope all the way up. So it's not uncommon to find high-performance athletes and those exerting themselves to a significant degree with temps of 101 to 103. Now, that said, that can be normal for some individuals, and 103.9 can certainly be heat stroke for another individual. So the temp is a great tool, and I'm strongly encouraging it because everybody should remember that temperature is a vital sign, and it's one that we leave out in the field. We commonly do the other three, but we leave temp out. So if we can begin to integrate temp as a common measurement, we'll start learning more about it and how we're actually performing and how it relates to heat illness in the wildland firefighting arena. But I think temps of 102 wouldn't be uncommon. You have to pair, again, the temp with the symptom. So one point I want to make real quick is that our bodies in general are not very good at telling us that we are becoming hyperthermic, i.e. our temp is going up. Our bodies are very good at telling us when we're getting too cold. We shiver, we seek blankets, we seek warmth, but we don't do that near as well when it comes to increased temp. Therefore, it's very important to learn the subtle symptoms that one gets as one's temp gets up.
This question is from Donald. What do you think about cooling vests? Cooling vests in a wildland fire environment, from what we've seen with the technology that's out there today, they increase the weight, so therefore you're having to work harder for a given activity, which is then going to produce more body heat. In a study we did in a lab, it was just 3 hours. For the first 45 minutes, we had a lower body temperature, but then after that, we actually had a significantly higher core body temperature compared to the non-vest. And that was because it was now insulating the body because it had dried out. Most cooling vests are only designed to maybe cool for about an hour. So unfortunately, the technology just quite isn't there yet for a lot of these cooling vest technologies. So that's kind of what I've seen on the different cooling vests. This question's for Roger, and I'll probably pass this off to Dr. Duncan. Is there any adverse effects with cooling the patient too rapidly?
Absolutely not. I have a long drawn-out answer to that question that I'm going to avoid. But in general, unlike some things in medicine, which we try and reverse things slowly, heat stroke is one of the things that the more rapidly you cool the patient, the better they're going to do. Basically, you want to reverse the, I hate to say cooking process, but the more rapidly you cool them, the better the outcomes are. You may have heard, whoever's asking the question may have heard that there's some subtle data that may reflect we shouldn't cool our our CPR, post-CPR patients too rapidly, even that data is somewhat skewed and questionable. But in heat stroke, we have 20 years of good data that shows the more rapidly you cool that patient, the better they're going to do. That's why I want to reiterate the importance of early aggressive cooling in the field. If we wait to get them to the emergency department, another half hour of sort of tissue cooking has occurred before that cooling process begins. So early cooling is key.
This next question is from James. When a firefighter suffers a heat-related illness that requires medical care, are they more susceptible to reoccurring heat illness issues? And James, based on the latest research, yes, they are. When an individual suffers a heat-related illness, heat stroke, and some of those more severe ones, they are more susceptible to having another heat-related illness. So as we see a lot of individuals playing sports as kids and have some, heat-related illnesses, or with a lot of veterans coming back from Iraq with those high temperatures, and if they suffered a heat-related illness over there, if you have a heat-related illness like heat stroke, you are more susceptible to another heat-related issue. This next one is for the Dr. Duncan again. This is from Pat. With field IVs used by our line medics in treating heat illness, what's your suggestion for fluids? Is LR best?
There's not a big difference between administration of LR and normal saline. There's no good studies on outcome data relating comparisons between saline and LR and heat stroke. The key really is just the rehydration, and if we can administer cool saline, that's beneficial. There's a couple of tricks to doing that. Putting the bag of saline in ice can be helpful, and it's just recently been shown that even gathering up as much of the IV fluid tubing as you can and putting it within an ice bath as you run the saline through it can be enough to cool the saline going in, and that can help drop body temp as well.
This next question is from Brent, and it says, is drinking cold water better than drinking ambient temperature water? Brent, when it comes to drinking, people like colder fluids. It's more palatable. They first showed that back during a lot of the early stays on heat stress during World War II. So if you're looking for a more palatable beverage, drinking cooler temperature fluids is better than drinking ambient temperature fluids, yes.
I'll add in just real quick, Dr. Duncan again. The physics of that also contributes, and would recommend that you drink cold fluids. Basically, that cold fluid goes into your stomach and absorbs a significant degree of heat to help bring your overall body temp down. That's just a general rule of thermodynamics. So that's one of the strategies we have in the emergency department, is what you'd call iced gastric lavage, where we circulate ice saline into your stomach to help reduce your body temp. So just help support the cold fluids are beneficial.
This next question comes from John. This is for Britt and Dr. Duncan. John's question is, current and former hotshots have told me they don't think it's a good idea to use AC in crew vehicles as a heat mitigation because going in and out of the AC works against acclimatization. AC was mentioned today as a recovery and mitigation tool. What are your thoughts on these current thoughts used by the field?
Dr. Duncan, this is Britt. You go first, and then I'll follow up.
Okay, sure. I think that's to some degree a wives' tale, and I'm going to divide that question sort of into two categories. One would be during training in relatively moderate climate. It may be true that you want to leave them out of the air conditioning to help improve acclimatization so long as you're doing no harm. But during work, again, this is all cumulative. So one's work contributes to one's heat illness or heat stress. So anytime you can optimize the cooling phase, if you can take that worker and put them in a cooler environment, you're going to bring their temp back down. You're just going to rehabilitate them to an improved degree and decrease the chance of heat stress as they leave that environment. So sort of two ways to look at that. But anything you can do to optimize the cooling measure you have in the allotted time that you have.
Thanks, Dr. Duncan. Yeah, sure. Thank you. This is Britton. Thank you, John, for the question. The best way I can answer that is 2 weeks ago I would have agreed with that as an old hotshot, because you're right, that was the common way of thinking. From what I've learned over the last week or so of doing all the research on this and looking at documents and talking to the doctors here, I would not agree with that anymore. I would agree with the doctor that anytime you can get them cooled down, that's the thing to do.
This next question is from Jeremy. Jeremy asks, does having your firefighters out doing daily chores in the heat predispose them to heat illness? Jeremy, I think it's very situational. If they are out, it all depends on their work rate, how hard they're working, what they're doing, what kind of recovery time they get. There's no good cookie cutter yes/no answer. You talked about preheating. So are they starting out if they're out doing chores in the morning and then get an IA call in the afternoon, have we preheated them from that work? Potentially yes, but driving out there, were they able to cool off? How hard were they working during the morning? Were they able to maintain a moderate temperature and not have a spike? So I wish I could say yes or no, but unfortunately when it comes to a lot of these human body issues, that we can't just give you a clear yes or no answer. It's in that shade of gray. So, and I'm not sure if Dr. Duncan, you'd like to comment any bit on that.
No, I agree. Again, when these questions are asked, my mind divides this into, is it training or is it actually out doing the work? And when you're out doing the work, you have to optimize whatever cooling you can take advantage of. When you're training, again, if it's in a moderate sort of environment and you're not pushing the heat illness spectrum, then spending more time in the hot environment is maybe going to contribute to one's acclimatization. So yeah, it's a tough question to answer.
Yeah. This next question is from Gene. He asked, could you talk to us a little bit about hyponatremia? What is it, and is it a major concern for wildland firefighters? Hyponatremia is where you have a low kind of electrolyte concentration relative to water, where it's kind of the opposite of dehydration. This can be an issue if you were drinking only water and not getting any sort of electrolytes, sodium, potassium, chloride replacement. One of the recommendations that's made is try to consume both water and some sort of sports drink, Gatorade, Powerade, one of those sort of drinks, because they have in there those electrolytes that are lost during sweat, but they also have carbohydrates, which our body uses for energy. So hyponatremia is kind of that other end of the spectrum. And I'll see if Dr. Duncan wants to throw anything else onto that.
No, that's key. I think there are 3 tools our body needs to optimize the location of that fulcrum again, and one, most important, of course, is adequate hydration, but two, adequate sodium stores. So the opposite of hyponatremia, adequate salt levels and adequate sugar levels have recently been shown to be extremely important as well. So those three constituents carried within our body, water, salt, and sugar, are all going to diminish one's chance of significant heat illness.
This question comes from James. He asked, can you explain the use of the WBGT in the field, and are the IMTs looking at this measurement during the planning stages? James, what the military and the American College of Sports Medicine recommend with the WBGT is it looks at the temperature, the humidity, but also that black temperature radiant heat from the sun. So it kind of just takes the current dry temp and RH and adds another factor into its calculations. The WBGT is going to be looked at this summer, I believe, trying to figure out how we can best apply it to use in the wildland firefighter community. There's currently some different conversion charts where if you only have temperature and RH, you can then get some sort of WBGT based on a conversion chart. So we're seeing how all of those can play into the wildland firefighter community hopefully this summer. I guess this is more of a housekeeping question that I'll pass over to our friends at the Lessons Learned Center. This has come from a few folks. Is how can people get copies of the PowerPoint or the webinar that was put on today?
This is Josh. We're recording the webinar right now, and once the webinar is over, I'll start uploading it. And so there will be a video file that will be posted on the Advances in Fire Practice webpage. And that's the Advances in Fire Practice is a sub-site of the Lessons Learned Center site. So if you look in the menu for the Lessons Learned Center, there will be one of the menu tabs will take you to Advances in Fire Practice. And so we'll post the video there, and then it has a link that you can send around by email, however you wish. But that should be up. It takes us about an hour and a half to get it uploaded after the presentation.
I know we're getting a little long on time. I want to get as many of these answered as I can. We'll probably go for about another 5 or so minutes, give or take. So just anybody who's sticking around. I guess this next one is sunflower seeds, good or bad? I'm all for them. I love sunflower seeds. There's something that gives me a little bit of sodium, as we talked about. It's critical for maintaining kind of our human body, and I just really like eating sunflower seeds. So I have not seen anything bad about sunflower seeds. Dr. Duncan, have you seen anything bad about them in the literature?
No, I sure haven't, and I agree with you. I think anything you can do to maintain some calories and some salt, just be sure and get some fluid along with that. Yeah.
I guess this is a little bit of a follow-up question from one of the earlier ones that you had, Dr. Duncan. This is from Alex. He asks, what's LR?
That is lactated ringers, and it's predominantly normal saline, but it has additional bicarb and a little bit of potassium in it. It used to be the go-to fluid for rehydration of very sick patients, including trauma patients, but there's never really been shown any significant benefit to using LR to normal saline. So we can think of them as equivalents. While I have the mic, I see one question up there that we may have missed, and that was a question about how accurate is using an ear thermometer for determining core temp, and they commented that they thought that was more a measure of skin temp, and it's a little bit of a mixed bag. It's kind of a half-half core temp, skin temp monitor. The way I would approach it is it's better than nothing, and if we can get tympanic thermometers into the field, we can start studying it and see what kind of numbers we're getting back. So I would encourage whatever thermometers we can get to just start getting a feel for what your norm is in your particular crew or unit.
I think we'll probably do one more question. And this one is from Paula, and she asks, is it true that diet pills utilized for their stimulant properties may contribute to increased dehydration and then lead to symptoms of heat stress? How is the fire world monitoring this? I'll answer the second part of that question, and then I'll pass it over to Dr. Duncan for the first part. In the fire world, does not recommend supplements. I know when it comes to vitamins and those sort of supplements, the NWCG has a policy that doesn't supply those to firefighters. So when it comes to monitoring that, I think it's a crew-by-crew basis, and I think that's it's probably a crew-by-crew or a person-by-person basis on what they're putting into their body. Now I'll let Dr. Duncan talk about how diet pills can affect your ability for heat stress and dehydration.
Right. The diet pills, all the various categories, all fall into that sympathomimetic category, which means to some degree they mimic what adrenaline does, and that's typically going to contribute to heat stress to some degree. Nobody knows exactly how much, but if we look at this again on a continuum and we move out into the cocaine methamphetamine realm, which is, that's Z, and we're just talking about, B or C, it clearly contributes and precipitates heat stroke. But all the sympathomimetics contribute to heat illness to some degree. It sort of depends, again, on how much you're taking, which one you're taking. In general, not a good idea.
Okay.
And so with that, if we did not answer your question and you would like an answer to it or some further clarification on, please feel free to, I believe, email any of us on the committee or, please give us an email.
Okay, this is Josh McDaniel. I've put up some links there, and the top one there is the link for Advances in Fire Practice, and that's where the webinar will be, the recording of the webinar will be posted. I've also put my email, so if there's a question that wasn't answered and you'd like it answered, you can send me an email and I'll pass it along to the panelists. And on behalf of the three organizations, the Lessons Learned Center, the IAWF, and JFSP, I want to thank all the presenters for putting this together. There was a lot of time and effort that went into putting this together, and there was this was done with a sense of importance that this was a topic that needed to get out to the field, and I just want to express our thanks to all the presenters for doing such a great job. And if you're interested in viewing or signing up for some of the future webinars, you can go to the Advances in Fire Practice, and the links are there you can find out which ones are available and which ones you would like to register for. So with that, I guess we'll close the webinar, and thanks to everybody for coming, and hopefully we'll see you at the next webinar. Thanks.